Polypharmacy and combination therapies rest on a structural assumption. Diversifying treatments across multiple drugs is assumed to reduce adverse event risk. Each drug targets a specific pathway. Covering more pathways is assumed to make the patient safer overall. This assumption conflates reducing per-drug risk with eliminating combined system risk. Treatment diversification redistributes individual drug risk across pathways. Each drug's individual adverse event probability may be low. The combined adverse event tail is not eliminated. Negative outcomes at the system level remain accessible, regardless of how many drugs are prescribed. Each drug in a regimen may individually remain below its organ toxicity threshold. Individually tolerated does not mean jointly tolerated. Combined pharmacological load can push the patient across an organ failure threshold. If organ failure is defined at the system level, individual tolerability of each drug does not guarantee patient-level safety. Individual adverse events aggregate into cumulative patient load. Across many drugs, typical metabolic interactions tend to smooth out. Typical burden appears manageable. Extreme combination effects persist in the joint distribution. Rare system-level toxicity events remain accessible regardless of the number of drugs added. Organ failure thresholds exist regardless of the number of treatments prescribed. Once the patient crosses a physiological limit, normal organ function is not restored. Physiological limits are absorbing states. Adding more treatments does not move that boundary. It changes the distribution of physiological outcomes, not the location of irreversible failure. The polypharmacy paradox. More drugs provide more coverage but raise cumulative toxicity exposure. Highly treated patients can cross absorbing physiological thresholds. Treatment diversification does not eliminate absorbing states. Personalized medicine addresses this structural limit. Survival at the patient level is physiological, not a consequence of the number of treatments prescribed.